Adil El Tayyar, a renowned surgeon with many years' experience in the National Health Service. Donna Campbell, a healthcare support worker who could light up a room with her infectious laugh. Just some of the UK health and care workers who've lost their lives to COVID-19, often for want of proper protective equipment.
My basic understanding of infectious disease is increased exposure equals increased risk of contracting that disease. And as key workers, as healthcare workers particularly, we are at increased risk of exposure because we are working with people who have coronavirus every single day. And without the right protective equipment, then there will be people who die because of being at work.
Every Doctor is a non-profit organisation run by doctors campaigning to keep health workers safe, as well as highlighting how far behind other countries the UK is in the provision of protective equipment, or PPE. Every Doctor hears daily from medical staff forced to use improvised methods to keep themselves safe. This is happening months after concerns about coronavirus were first raised by health workers in the UK, and despite repeated government promises that items of PPE have been procured in their hundreds of millions and are being widely distributed. As Britain nears the peak of its epidemic, dangerous gaps remain.
Well, I'm sorry if people feel that there have been failings. I'll be very, very clear about that. But at the same time, we are in an unprecedented global health pandemic right now.
Critics called the Home Secretary's apology half-hearted, and the Public Services Union UNISON says the time for excuses has passed.
Well, we're continuing to see significant problems with the supply of PPE in social care. Social care staff are still telling us that there are major shortages. We've had some members telling us that employers are refusing to let them wear face masks.
To help close the gaps, this group of London-based entrepreneurs has pitched in 3D printing visors for NHS hospital staff.
I was inspired by one very sad story about Norfolk Park nurses who are using bin bags to protect themselves. So using 3D printers behind us, we're able to manufacture this face shield. The face shield can be 3D printed in just under 2 hours. And using just some simple elastic and acetate sheet that has been laser cut, we can ship these out directly to hospitals that desperately need them.
There will be a time for answers, time to ask who failed, how and when. But for now there is only reality to cope with. Health workers in hospitals and care homes across the country short of basic protection as they tend to the sick and the dying, and in some cases having to decide whether saving a life is worth jeopardising their own. Jonah, Al Jazeera, London.